Welcome back to another video. In this video, I'm going to cover how to apply for a license to operate a home care agency in the great state of Indiana. I'm going to share my screen and go through what the forms look like and what all the requirements look like. Let's get into it. I'll be sure to add this link in the description of this video so you have easy access to it. Once you get to this page, all you have to do is scroll about halfway down the page and you'll see a section that says forms. And under this section, look for, I think, the second bullet point that says application for license to operate a home health agency, State Form 4008. Once you click on that, it'll redirect you to a PDF. And here's what the PDF looks like. Make sure you have the right PDF. It should state application for license to operate a home health agency, State Form 4008. For the sake of this video, I'm just going to cover the first page and the last page because that's where most of the instructions are on what you have to submit to the state. So it's only 8 pages, so it's not too crazy, it's not too intimidating. You can literally complete this on your own over a long weekend or even a short weekend, depending on how quickly you get through this information. So let's start with the first page. It says here, all questions on this application must be answered completely in printed or typed script, which means that all you have to do is fill out this form on your computer, or you can use your handwriting. Personally, when I submit forms to the government, I don't like to fill out by hand. I like to type in first on my computer, then save that PDF, and then print it and then mail it out. That's just what I prefer. And it says here, an incomplete or illegible application will be returned without being processed. So you want to make sure that everything that you filled out is easy to read and easy to understand. Next says a license renewal must be obtained annually. So this license has to be renewed every single year. This application and license are neither assignable nor transferable. Pretty straightforward. You cannot transfer the license to somebody else who was not the original applicant. Previous receipt of a license is not a guarantee that a license and or approval will be issued. If you were issued a license last year, it means that you still have to renew this year and it's no guarantee that you'll get it. Next is a non-refundable application fee and the amount of $250 must accompany this application. No license or approval will be issued without payment. Pretty straightforward. So you know what the fee is, $250 non-refundable. The rest of the pages in between the first and the last page are just sections where you have to fill out with all your details. I'm skipping to the last page, as I mentioned, because there are additional instructions on what you need to submit. Now in the last page, page 8, it looks like here we have 4 major things we need to submit. Let's go through these together. The first one is the non-refundable license fee of $250 that was covered on page 1. And this should be payable to the Indiana State Department of Health and mailed with the application to the following address. And then be sure to read up on all the details below that. Secondly, you're supposed to provide copies of the administrator and the alternative administrator's current Indiana license. Number 2 is really pertaining to those folks that are looking to renew their license. So if you don't have a license, obviously, you have nothing to show, as bullet number 2 says. But if you are renewing, you have to submit a copy of the old license. Number 3, articles of incorporation, documentation that just shows that you have an LLC or an S-Corp and you're ready to pay your taxes. Number 4, it says submit an SS4 or other comparable documentation from the IRS that reflects the ownership, entity, and name. And then what this is just saying is that they need proof that you will be able to pay your taxes to the IRS, and an EIN, commonly referred to as a tax ID number, should suffice for point number 4. Based on my research for the state of Indiana, I have not seen any requirements to submit what are called policy and procedures. Typically, most states, when you have to submit an application such as this one, they ask you to submit what are called policy and procedure manuals. These are just company documentation that proves that you know how to run a business correctly, and you know how to manage your staff correctly, and you know how to manage the client's data correctly. That's really what it is, that you're in compliant with the state rules and regulations. And usually a lot of people get jammed up in that process. Since the state of Indiana did not clearly state that you are required to submit a policy and procedure manual, still reach out to somebody in the Department of Health with the state of Indiana and get even additional clarification. If it turns out that you do need those policy and procedure manuals, then I have some good news for you. Because usually this process of creating your own manuals is time consuming, takes too much time, and requires so much documentation. I've created these home care policy and procedures templates. What these are Word documents which you can purchase and you can download, and these work for any state. These are over 100 Word documents. You can simply plug in your company's information somewhere at the bottom of the page, and they should be good to go to submit to the state of Indiana. But before you make the commitment to purchase these, be sure to inquire with your state to ask or to clarify if you do need a policy and procedure manual. Because if you recall, in the first page of the application process, it states that if the application is incomplete, then it'll be sent back. So you don't want to risk that situation happening, because you will lose your $250, and that's no good. So reach out to the state first, and then you can purchase these policy and procedure templates. I'll be sure to put them in the description of this video, and I hope you got some value from this video, and good luck with your application. See you in the next one.